Public policies serve as the cornerstone for how governments address critical public issues. From road safety rules to tax codes and educational curricula to healthcare services, these policies shape the fabric of society. However, crafting such policies is no straightforward task. It requires the collaboration of multiple stakeholders, extensive deliberation, and a deep understanding of the issues at hand. Years ago, Kaduna State was at a critical turning point, confronted by mounting societal challenges that demanded an innovative response. Recognizing that traditional governance was no longer sufficient, the state sought a solution rooted in precision, foresight, and accountability. The answer was clear: data-driven policy making. This was a profound commitment to basing key policies and interventions on concrete, reliable data. It promised the people of Kaduna that the government would be guided by evidence, not guesswork.
Data is critical to the health sector, it's critical to decision making, it's critical to logic. We have had a system previously, I will say in sub-Saharan Africa and in Nigeria, even Kaduna State, where decisions are made based on assumptions. Data provides you with a realistic picture of what is existing in your state, a real need. You can assess a real need for your people, and it helps you to plan based on a needs assessment. And for us in the health sector, data is our best friend, because we can't work without information on our population. We can't work without information on key variables that determine risk behavior, that determine treatment outcomes, that determine interventional strategies that are more effective for the community. And data as a source of information is critical to us. It's the same thing for investments, because investors who come to a state like Kaduna State, particularly international investors and those from the private sector, want to know what you have in your state. You can't tell them verbally, Kaduna is like this or it's like that. What they want to know is, how many houses do you have, for example, in the housing sector? What type of houses do you have? And that is data. How many people live in the houses? What's the land mass in your state? What amenities do you have in your state? It informs justification and our fulfilling eligibility criteria for funds, for loans, for grants, and for partnerships and investments to develop the state.
Kaduna State Bureau of Statistics, we call it the KDBS, was established in the year 2014 by Law Number 3 of the Kaduna State government. The sole mandate of the Bureau is to oversee the activities of the state in terms of data generation. So we are the sole supplier of statistics for the state. Our mandate is to collect, analyze, interpret, and disseminate statistical information for the state. We do it either alone or in collaboration with MDAs, governmental organization and non-governmental organization. So we also oversee the state statistical system. We coordinate the state statistical system. What do we mean by state statistical system? This is either the MDAs, partners, or whoever that is generating statistics, that is generating data, we coordinate that one. We have a committee called State Consultative Committee on Statistics. We harmonize data. We follow a standardized methodology. So we coordinate that one. It is also our mandate to oversee the statistical activities of both the state and the local government. We advise the state on statistics. We advise the state on data regarding statistics for the state. So we also do any other activity that the state government asks us to do. So these are our mandate for the Kaduna State Bureau of Statistics.
Well, as Permanent Secretary, Plan and Budget Commission in Kaduna State, our role is coordinating the entire state activities in terms of planning, budgeting, development aid coordination, monitoring and evaluation, statistics, data gathering and management, and then many other things that will improve governance and service delivery. That's our main mandate in the state. And of course, as planning outfit that develop the planning space for the state, for all the sectors in the state, data is very important. We are doing budgeting, we are doing planning, development planning, sectors planning, all those kind of planning. Therefore, you cannot achieve that without a reliable data. So basically, data is very important, for planning.
For Kaduna State, we leverage on the use of data to have better information in decision and policy making in the areas of health and education, and of course, economic development of the state and social development as well.
Formally, you had to make a presentation. For example, in health, we have what we call indicators of development, such as maternal mortality rate, infant mortality rate, how many women are dying, how many children are dying, what's the malnutrition rate in the country. There are standardized measures used by every country in the world. And you must have that information from a data source to be able to project those standardized indicators. So because that was absent, it was incomplete, and sometimes the reporting was not timely, we were not able to communicate the right information at the right time to inform the right decisions and the right policies to be made at state level.
First, the challenge we have is, fund. Though anywhere you go, even in the central bank, they still tell you fund is a problem. Fund for generating data quality. Fund for generating data is a problem. You send people to the bush, you need to give them money for their upkeep, transportation, and all that. So one of the challenge that affects data is fund. So another challenge is, accessibility. Some of our local government are having security challenges. So area where there are security challenges, we find it difficult to cover it all. Even though we have some modalities to mitigate this issue, but still is a challenge. We do have a community of practice enumerators where they are resident of that particular area. We send them, we bring them up here, train them, and then send them back. These are kind of thing we do, but still is a challenge. So another problem is death of data culture, especially at the local government. So you find out that when you send in template, they don't populate timely and send to us. You need to follow it up, this kind of thing. So it takes time. Sometimes they don't even send. So it is really a challenge to data integrity. In some aspect, terrain. Sometimes during rainy seasons, to access some places is a problem, especially when it comes to harsh weather conditions and others. So these are challenges that we routinely face when we collect data.
There is a challenge of collaboration between government agencies and of course the private sector, and also most of the information and data that you are getting is fragmented if there is no collaboration. And of course one of the biggest challenges is the insufficient funding that is coming in the area of data collection and all that.
Out of this commitment was born the Kaduna Data Lab Project, a visionary initiative designed to revolutionize how data was collected, analyzed, and utilized across the state. The joint initiative between the Kaduna State government and the Bill and Melinda Gates Foundation was designed to re-engineer and professionalize the Kaduna State Bureau of Statistics, enabling it to evolve from a traditional data producer to a sophisticated consumer and user of data. Behind every evidence-based decision lies a meticulous process of data collection, processing, and analysis. The Kaduna Data Lab was imagined as one that will adopt cutting-edge technology and tools to ensure that every data point is accurate and actionable. As the Data Lab project entered its advanced planning stages, it became evident that a skilled and visionary technical partner was essential to bringing its ambitions to life. Enter the Natview Foundation for Technology Innovation, NFTI, a non-profit organization that is committed to using data to advance social good. Thanks to the BMGF grant, the KDBS and NFTI Both accepted the challenge of realizing the Data Lab's ambitious objectives by incorporating state-of-the-art technology and innovative solutions into every aspect of the project. Over the years, these partners have become a potent force for positive change in Kaduna State.
The Kaduna Data Lab Project is really an attempt to implement the Data Revolution Plan by the Kaduna State government. The Data Lab is an investment through the Bill and Melinda Gates Foundation, and NFTI is a grantee for that foundation, for that Data Lab project. So primarily, the Data Lab project is designed to professionalize the bureau, to make it a data service agency that really provides data service to different health ecosystem players. So we do build a state-of-the-art modern data lab, and then it has several components of it across board. I mean, NFTI was the implementer, so we are the grantee charged with the responsibility of implementing the grant. So across board, in terms of setting up the data lab, training the bureau in terms of data management practices, building platforms for the bureau as a gateway for health sectors to use, and also the most exciting part, integrating young people as part of the broader ecosystem for data management.
The Kaduna Data Lab Project marks the beginning of a new era. One where data became the backbone of governance, where numbers told the story of progress, and where every statistic contributed to a brighter, more equitable future for the people of Kaduna State. It was about leveraging its power to address the state's most pressing issues, from healthcare and education to economic development and beyond.
The state has the State Development Plan, which at the end of every 4 years is being reviewed. And then in that State Development Plan, the Bureau of Statistics work with Planning and Budget Commission to develop what is called the result framework, where all indicators that is related to that, to be able to track that State Development Plan, which is the Bureau that collects the information. So you can see with that, it helps the state to be using data to track the performance around the sectors, not only health, education, all the sectors. And we are able to track the State Development Plan, the SIP, that is the Sector Implementation Plan, together with the M&E Department in Planning and Budget Commission. And it's make us to, even in terms of working relation with other NDA, we have a understanding. And secondly, now, despite that, we are still having some issue in terms of collection of information around other NDAs, but at least there is some level of improvement in that aspect.
The health sector has been the most beneficiary of the work that the grant has done. Why? Because they now have a frame of data that they can use for decision making and evidence support. So from HEFA to supportive supervision to human resource for health to connecting young people to the health ecosystem, you see that the health has been, but ultimately I think it's the citizens of Kaduna. A lot of the data that has come out has informed a lot of work in terms of what's happened. So for example, the general household has identified Sanga as an area that requires investment in terms of health. You would see that there is a dedicated effort to make sure that primary healthcare in Sanga are more facility ready in terms of that. So yes, I think everyone in Kaduna would have benefited one way or the other, but the health ecosystem are the key players in terms of who have benefited most. And the Planning and Budget also Commission have benefited in terms of this State Development Plan and those other key plans that would drive the health policy in Kaduna.
Kaduna State Health Analytic Platform, we call it HEFA, is routinely used for evidence-based data. It is housed in our server. It is housed at the Bureau. So we access it because people from health do come to ask for data. Sometimes we ask them to access the HEPA platform. There is a bunch of data there. and sometimes we access the data and give it out to them. So as I said, not only health personnel do access the HEFA. I told you investors also access the health analytic platform. Visitors that are even coming to Kaduna, the good thing about it is, you just come into Kaduna and you want to locate a health facility, whether primary or secondary health facility, the nearest to you. So just go to HEFA and it will locate you where closest health facility is. You will see the doctors available on the platform, how many doctors are there, what kind of services they render. For example, you want to look at cardiologists there. So health facility will quickly help you to locate this. So that's to tell you that it's not only restricted to health. It is for the population, for the entire population of Kaduna State, and it has been accessed on a frequent basis, and we also access at a frequent basis.
The staff at the Kaduna State Bureau of Statistics, after the development of the health facility analytic, that is the HEFA, they have been carrying through on how to navigate and use the platform, and they can even go out and train or advocate the health facility analytic. The staff of the Bureau of Statistics are using it even both officially and personally to access health services around the state.
The Human Resource for Health platforms, we have supported the state to build two different platforms. The first one is the Human Resource for Health SOP, which is domiciled within the State Ministry of Health. It's just a mini system that allows them manage their human resource at the ministry level, while we have worked together with the State Primary Health Care Board to develop an extensive Human Resource for Health management system. So with the management system, it allows them to have an overall picture of their human resource workforce, from their profiling to the retirement forecasting, to gap analysis, to healthcare financing, human resource for health financing. It also allows them to update records of their employees. Currently, we are supporting the state in really digitizing more than 5,700 records of all the staff of the Primary Health Care Board, ranging from their career paths to their educational documents and everything, just so as the state will have a comprehensive profiling of their health workforce.
I interned at NFTI after my fellowship, and there I have worked on the HRH project, which is the Human Resource for Health project for both the Ministry of Health and Kaduna State Primary Health Care Board. Now what this does, it allows the policymakers to have a view on health personnel of the state, tracking movements via transfers and progression via trainings and promotions. I'm currently working on the supply chain management project, where we are trying to digitalize the workflow process and create a dashboard in order to track the use of essential medicines from procurement to the last mile, which is to the last person or to the clients that will use the drugs.
So HEFA so far has more than 11 data sources. It serves as a platform or one-stop shop for anything analytics that has to do with facilities, both at ownership level, management level, location, type, and all that. So HEFA is a very diverse platform that has really integrated sources that has to do with equipment across facilities, infrastructure, the services they are providing, and even as well as far as human resource for health. So HEFA is a platform that supports the state in really understanding the situation of health facilities and serving as a platform for policy making around improvement of health facilities in the state.
The ISS translates ultimately to better healthcare delivery. So better healthcare delivery means healthier citizens, and that's how it impacts or improves the healthcare of citizens, and that's how it benefits them. When that data is collected, it ensures that decision is based on data. Those decisions affect the healthcare that those citizens access, and in turn ensure that they're healthy and you have a healthier society. The ISS is an exercise, a supervisory exercise by the Ministry of Health and the State Primary Healthcare Board to ensure that there is optimal healthcare delivery in health facilities across the state. So healthcare delivery, from interventions to the drugs, to ensuring that people get the services they require or they want to access in those facilities.
Before our intervention, ISS has been a paper-based tool that the states do go to the field to actually do supervision and take in the checklist that they use paper to fill in. So as part of our support in really triangulating multiple data sources to HEPA, we supported the states through the Data Science Fellowship Program and the Bureau of Statistics to actually digitize the ISS process. So we started off by really scripting of the ISS tool from paper to an ODK form that they are using to collect the data. So far ISS has more than 22 interventions, and they have like a team that goes to the field on monthly or quarterly basis to collect data, and as they collect data, we have like an error workflow that checks for completeness of the data in terms of location, completeness of the data, accuracy, and also timeliness of the data collected. So as before the data is being approved, it has to go through some error management flows before the data is finally approved. ISS is also a very good platform for the states in terms of really knowing how facilities are performing across these 22 different interventions. So it has like a score for each facility where you know in this administration or human resource or HIV service interventions or adolescent health or child health, or even within all the RMSCHN continuums, they are able to see the performance of facilities. At the same time, they are also able to see the performance of the states to identify where there are gaps and plan out how the next supervision will take place. So ISS is a very powerful tool, and it's an organic system. We are still improving it. We are still getting feedback from stakeholders and building on what is existing now. And as it is, ISS is also pipelined to HEPA to kind of give us a better frame in terms of how data from routine operations like ISS is collected and also pipelined to the HEPA platform as a whole.
The Kaduna State Bureau of Statistics, KDBS, established under Law No. 3 of 2014, is the official custodian of data in Kaduna State. KDBS, as an agency under the Planning and Budget Commission, has the mandate to produce accurate, reliable, and timely data, whether independently or in collaboration with ministries, departments, and agencies or international partners. With the launch of the Sustainable Development Goals (SDGs) in 2015, Kaduna State embraced the data revolution with full force, incorporating global best practices into its development strategies. The Kaduna State Data Revolution Plan served as a blueprint for this new direction, with key action points guiding the transformation. Developing a global consensus on principles and standards. Kaduna State took bold steps by adopting and integrating the SDGs into its state development plan, ensuring that its policies aligned with international goals for sustainable growth. Sharing technology and innovations for the common good. KDBS became a pioneer in using modern technology for data collection, employing cutting-edge tools to ensure accuracy and efficiency in data gathering processes. New resources for capacity development. Recognizing the importance of skilled personnel, Kaduna invested in capacity development, ensuring that resources were allocated effectively for regular, institutionalized, and independent data collection. Leadership for coordination and mobilization. At the highest levels of governance, leadership was institutionalized to coordinate and mobilize efforts around data collection and usage, solidifying the role of KDBS as a cornerstone of Kaduna's governance strategy. In the years that followed, the Kaduna Data Lab Project would have a huge effect on many people's lives. However, how exactly did this change unfold? What were the most important factors that led to this success? How did the Kaduna Data Lab Project use data to make real changes? As Kaduna State began its journey towards data-driven governance, a critical question emerged. How does the state ensure that the momentum gained through the Data Lab project is sustained? The answer lies not only in technological advancements, but also in the people who would drive this transformation forward. Having the relevant skills can mean the difference between success and failure in the age of data-driven decision-making. The state of Kaduna saw the need for the Data Science Fellowship Program, which aims to equip young people with cutting-edge data management skills. The Click on Kaduna Data Science Fellowship Program, DSFP, was born out of this necessity, a strategic initiative aimed at addressing the pressing need for skilled data scientists who could harness the power of data to inform and improve governance. At the start of the Data Lab project, Africa faced a significant shortage of trained data scientists, with growing demand outpacing supply. This shortage posed a considerable challenge to the long-term success of data-centric initiatives like the Data Lab project. As a result, the Kaduna State government, in partnership with the BMGF, the KDBS, and NFTI, conceptualized the fellowship program as part of the State Data Revolution Plan, aimed at strengthening coordination in the collection and use of data for evidence-based decision-making. The key desired outcome of the program is to create a pool of digitally relevant youth who can perform data management functions to contribute to evidence-based policy decision-making and serve as an opportunity to build a career in data management.
I played the role of being the project manager of the Data Science Fellowship Program, which is part of the Data Lab project. It gives me the opportunity to oversee the pre-implementation and the post-implementation of the project. The Data Science Fellowship Program was designed to create a pool of relevant technologies through Kaduna State youth by the ages of 18 to 35 with the use of data management to derive policy making.
Kaduna Data Lab project, I played a very significant role around being the knowledge management officer. I ensure that all processes are being documented, that all processes in the project it's been documented, and also to ensure that staff's productivity is being optimized. The Click on Kaduna Data Science Fellowship Program is actually a global standards program because of our curriculum, because we had to ensure that we follow the trends to follow the trends by integrating artificial intelligence, machine learning, and all across board, just to ensure that we have a full-fledged data management value chain. And also because we are ecosystem disruptors, so we actually disrupt the ecosystem in Kaduna.
DSFP is a really good platform that allows young people to really support the state in providing the right data at the right time, and support the state in really triangulating different data sources that will help the state in making informed decisions, especially across the health continuums. So far the fellowship program is different from the normal contemporary data science training, because it covers not just the technical skills but also learning how to do a lot of data triangulation and as well data governance. It gives the fellows the opportunity to actually learn and understand some guidelines that has to do with data privacy, with health research ethics and all that. So the fellowship program also looks at building case studies around working with real data and understanding how the Kaduna State Bureau of Statistics really works with data, which is really quite different from the normal data science trainings out there. With the fellowship program, it's very intensive, and it allows them to learn not just in a classroom environment. For every module, they have to do some group assignments. They also have to do some case studies. They also have badges to also build their skills within every module of the fellowship program. Then after that, they also go out to the field to support the key health MDAs and the Bureau to triangulate data and support them in their data activities.
Click on Kaduna Data Science Fellowship Program is one component of the Kaduna Data Lab Project, which aims at building capacity and training of fellows on data management value chain. There are a wealth of opportunities gained through the Data Science Fellowship Program, not only to me, but to other fellows. Part of this opportunity, one out of it is the first intent of the Data Science Fellowship Program, which is capacity building across data science and data management value chain. And it also opened an opportunity of professional networking to me. And the Data Science Fellowship Program also equipped me with a set of skills using advanced tools for data analytics, and also create an opportunity for me to wine and dine with expertise in the field of data science and data management value chain.
The fellowship program was an intense 6-month program. The first 3 months were in-class sessions, while the 3 months after were field activities. And it was intense, but in a way that makes you grow and that forces you to adapt to new knowledge and information. The fellowship exposed me to networking opportunities. It enabled me to connect with professionals doing exciting things with data science in the health sector. It has also helped me to thrive in an environment of learning and innovation.
Being an alumni of the Click on Kaduna Data Science Fellowship Program, fellowship equipped me with the right skills needed for data analysis, data analysis and reflection. And it is very fulfilling to see that my role and the skill set that I've acquired through the fellowship has been applied to improve healthcare delivery, ultimately using data for social good, to improve healthcare delivery, to improve the healthcare of the system, seeing how the work I do makes impact to everyday citizen in Kaduna State, and how my work over the years have translated and have assisted people in power, people in government, to use those data for informed decision making. For example, quite recently, there was a grant to a partner wanted to support with tablets across facilities. And because of the ISS data, we identified facilities that had some gap in health management information system. Using the ISS data, we understood how we were going to divide those gadgets that were limited in number. And it was all thanks to the ISS, which I was part of. So that was quite a fulfilling moment for me.
The fellowship program offers a unique opportunity for aspiring data scientists to hone their skills, gain practical experience, and make meaningful contributions to real-world projects. The selection process is rigorous, ensuring that only the most promising candidates are chosen. From the first to the third cohort, the program has grown, evolving with each iteration to meet the changing needs of the state. One of the most transformative aspects of the fellowship is the integration of high-performing talents into the KDBS's operations. Here, they contribute directly to the Bureau's data operations by providing support to fill certain critical analytics gaps needed to interpret complex data sets. The fellows work closely with senior and mid-level managers across various MDAs in the Kaduna State government, particularly in the health sector, to facilitate the use of data to enhance policy implementation and provide vital health analytics that impact citizens' livelihoods. The program's fellows have made significant contributions to critical platforms such as the Integrated Supportive Supervision (ISS), General Household Survey (GHS), and Health Facility Analytics (HEFA). They have also been instrumental in the development and management of the COVID-19 dashboard, an essential tool in the state's pandemic response. In a bid to institutionalize data efficiency, public officials in the Department of Planning, Research and Statistics (DPRS) within key MDAs of the state, with a greater focus on health-related MDAs, were included across all the cohorts. The third cohort in particular drew 40% of its fellows from the civil service, ensuring that the fellowship's impact is felt across the entire state. This strategy has lowered entry barriers for individuals passionate about using data to improve public programs and track complex development performance indicators.
You know, one significant aspect among the aspects among the significant aspects is the Data Science Fellowship Program. You know, the Data Science Fellowship Program is centered around developing human capital, around data science, around use of data in policy and decision making. So, so far, the Bureau, in collaboration with Natview Foundation for Technology and Innovation, funded by BMGA, has really done tremendous work. About 110 youths has successfully graduated from this. Now, these youths are scattered across the state, not only the state, across national, even global. Some are working at a global level, some are in Nigeria, other part of the country working, some are contributing to the state. So if you train someone, you've trained a nation. So data science has really impacted greatly in the lives of Kaduna State, in the lives of the Bureau. Another thing is that, you know, the youths we train, the 110 youths along 3 cohorts we train, are part of our community of practice. They are now giving it back to us, what they have learned. We call them frequently, give them assignment, do some work for us. Notably, now recently, the ones that have graduated are the people conducting citizens' perception on insurance scheme, health insurance scheme. That's we call it Kachima program. So they are the people that are doing the survey for us. So a lot of our work has been eased by these youths. Talk about data analysis. You know, the youths, the data science fellows, we call them as a community of practice, give them tasks in data analysis, they do data analysis. There's one important thing they do for us as well, deep dive study. You know, when we go to the field, collect data, and then we have some information. But it's a quantitative data. A quantitative data does not go deep into the cause of what is happening there. For example, recently we conducted learning poverty. So some local governments are below the proficiency level. They are just down. So now we ask them to go back to this secondary school, look at why they are low in terms of learning assessment. We now ask them to go to this look. Are they having so many out of school children? Why are they so low in all the indices? We ask them to go back and do a deep dive study. In our general household survey, we see that some local governments have performed very low in some indices. We ask them to go and find out what is happening. They come back, write report and give us, so we give this report back to the state government for policy formulation. So the Data Science Fellowship Program has really impacted not only the Bureau, but Kaduna State. We are proud of our fellows. We are proud that we are part of this data science fellowship program, and we feel we can do more. So we've just started the fourth cohort.
From the first DSFP fellowship that we held, which is DSFP 1.0 to currently DSFP 3.0 that we just rounded up, we ensured that in whichever we at each layer we try as much as possible to make the program better. How do we make this? We get feedbacks and referrals and the challenges that we've had from the current fellowship that we are currently doing. So for example, we're trying as much as possible to follow the global trend and ensure that the skills that we're giving these fellows are top-notch and globally recognized. There's a tweak to DSFP 4.0 because of what we've seen from the previous DSFPs that we've carried on. DSFP 4.0 has a different tweak. The tweak is we're trying to introduce specialization courses after the in-class activities that the fellows have carried on. These specialization courses are subdivided into three, mainly data engineering, GIS and remote sensing, and also machine learning and AI. These are the part of curriculum. On the other hand is we try as much as possible to change the case studies that the fellows use during the classes so that it gives them a real life experience of what they're currently working on, and it gives them a better perception of what they are. For example, for the DSFP 3.0, the fellows went through the citizen perception survey, which had to do with telepolling. At each year, we try as much as possible to bring a case study that the Kaduna Bureau of Statistics is currently working on.
The DSFP program has consistently been improving. Like I said in my previously, the curriculum, we had to follow trends. So as trends flow, we flow with the trends and all that. So, and also because we are seeing tremendous impact in the lives of these young people who came with no knowledge of data science, and then the transition to young people who are doing well, contributing immensely to the Kaduna State government in terms of pipelining and triangulating data, and more importantly is their highly economic participation. That is to say, a lot of them have gotten jobs and are doing well. One of the greatest of all is the integration of civil servants in the fellowship program. We have 40% slots for the civil servants in Kaduna State across all MDAs who are indeed doing well.
The benefits that the fellowship program aid at my current position and capacity at my place of work. One is professional development. My skills have been developed. I've been equipped with high skills that is required in data management value chain. And the data science has also aided me with networking, whereby I work with also not only the fellows, but also through the mentorship of our instructors and co-instructors. Whenever I have a problem at hand, I run to them and we share idea and knowledge sharing, and I will be able to provide an effective and accurate solutions.
At NFTI currently, from the DSFP 1.0, we have a fellow that we have fully taken in, and he's our analyst here, working very, very hard and working in different portfolios. With the DSFP 2.0, we have 8 analysts as data analysts currently working with NFTI, fully onboarded. And currently with the DSFP 3.0 for fellows, we have 16 interns working as our junior data analysts, assisting and supporting the states through different portfolios across the integrated support supervision, the ISS, human resource for health, HRH, and also telepolling.
I'm really quite fulfilled because this is a local homegrown solution. The people who are making impact on this project are people from Kaduna, in Kaduna. Young people who are really disrupting systems and are ensuring that we are achieving scale for impact. And as you know, our goal is data for social good, and I think by and large that is the vision, and I think I'm really quite excited about the possibilities of what young people can do. And I think that for me is really one of the fulfilling moments around the field.
With DSFP has is a really good platform that allows young people to really support the state in providing the right data at the right time, and support the state in really triangulating different data sources that will help the state in making informed decisions, especially across the health continuum. So far the fellowship program is different from the normal contemporary data science training, because it covers not just the technical skills but also learning how to do a lot of data triangulation and as well data governance. It gives the fellows the opportunity to actually learn and understand some guidelines that has to do with data privacy, with health research ethics and all that. So the fellowship program also looks at building case studies around working with real data and understanding how the Kaduna State Bureau of Statistics really works with data, which is really quite different from the normal data science trainings out there. With the fellowship program, it's very intensive, and it allows them to learn not just in a classroom environment. For every module, they have to do some group assignments. They also have to do some case studies. They also have badges to also build their skills within every module of the fellowship program. Then after that, they also go out to the field to support the key health MDAs and the bureau to triangulate data and support them in their data activities.
The DSFP program has indeed beneficial to the Kaduna State Bureau of Statistics. Number one, because the bureau is actually the custodian of the program, and then our fellows have really supported our bureau in terms of strengthening the coordination of data. So basically for telepolling, which is a perception survey, we've seen our fellows supported to ensure that they collect good data and then pipeline that data for a very good evidence-based decision.
Fellowship have made tremendous impact within the state and within our youth in Kaduna. It has improved and amplified the stakeholder relationship that we have with key stakeholders of the fellowship. And finally, it has technologically and through the data science, through the data management chain, we brought up an ecosystem disruption within Kaduna State.
The program's success is undeniable. From 2020 to 2024, 110 fellows were trained across 3 cohorts. These fellows have not only transitioned into promising careers, some with global institutions like JP Morgan Chase, Deloitte, and the Clinton Health Access Initiative, but have also significantly contributed to the Kaduna State public health sector. The fellowship boasts a remarkable 70% transition rate, with many fellows securing improved job opportunities in both the private and public sectors. Years from now, the Click on Kaduna Data Science Fellowship Program will be remembered as the catalyst that laid a strong foundation for Kaduna's digital economy. It has created a niche as a powerhouse for youth capacity building and demonstrated the immense value of investing in young minds. Across Kaduna, the transformative power of data is felt by people from all walks of life. From the healthcare workers saving lives, to the government officials making informed decisions, to the expectant mothers in primary healthcare centers in rural communities, and the young data scientists who are shaping the future, the Kaduna Data Lab Project has left an indelible mark on countless lives. But as with many groundbreaking initiatives, the journey does not end with initial success. The true test lies in maintaining impact and driving sustainable development.
You know, one important thing we always think about is sustainability. We have put a lot of systems in place to in order to sustain this. For example, in terms of capacity building, we've been training youths in use of data, appreciating data on others, so that they will appreciate, they will advocate, they will now tell others the use of data. Here, like we do kind of a capacity building, not only to the youth, to other MDAs, in order to disseminate the idea, the knowledge of statistics to other people. So in terms of the building, the state government gives overhead. We use the overhead to take care of the building. So we have a lot of sustainability plan in place so that this will sustain not only to us, not only to our children, but to our grandchildren.
For one thing, I was at the graduation of the last class. I know for a fact the governor has reaffirmed his commitment to ensuring the partnership established with Bill and Melinda Gates Foundation, the facilitators, and the conceptors of the program is maintained. So it is an agreement that is infinite. Kaduna will always be willing to participate. The state government has provided a permanent site. The data lab where these data graduates, so to speak, or IT experts, are trained is within the property of the state government. It's domiciled within the complex of the Planning and Budget Commission and the Ministry of Finance. So they are partners and the Bureau of Statistics. So they will never lose office space. Now, additionally, we ended up giving them some incentive. They are paid a particular percentage of money as a stipend, as running cost. That encourages them. We know all the challenges we have. It's not easy. I mean, even transportation for them to leave their homes and come for the fellowship. So the fact that they earn an income actually keeps them committed. Thirdly, we've been able to incorporate them into existing systems within the state sectors based on their areas of interest. Because we ask them, are you willing to participate? What are you interested in? And they all admitted. Some will tell you, I'm more interested in health finances. Somebody will tell you, I'm more interested in primary health care or reproductive health. So we've been able to give them an opportunity for employment. They get employment, they get a sort of internship, they get certifications, and they get international contacts and local contacts because they attend our meetings. We go for meetings with the World Health Organization. It's an opportunity that someone probably at that age or with that limited experience will not have access to a room like that. But they get to sit in that room with experts in the sector and interact and form contacts and network. And it has opened an infinite window of opportunity for them for career development and growth. And of course, we have other partners we are in discussion with to add additional sponsorship. Our plan is hopefully to be able to upgrade it to a larger number. We have a population of 10 million. So I mean, even graduating 1,000 data managers or IT specialists a year is not adequate to meet all the needs of a state like Kaduna. So our ambition is to scale up, to have more data labs where possible, or to increase the size of the one we have. So sourcing for partnerships and funding and better collaboration is also ongoing.
Now the governor is interested in this. We are trying to ensure that the system is improved, the data science fellowship. So the system now is that we want to make it more robust. We want to make it more inclusive to ensure that both sex, the female and the male, are involved in the data collection and across all the local government areas, so that even the out of reach areas, because we train the people, the youth from that area, then they'll be useful from that area, and then we want to cover the whole state. You understand? The youth there, the highways people, the IT, the NYC guys, and then those we train them during the data science fellowship. We want to make sure that they are all in the field, they all understand the system, they are all well trained, and then so that they can collect the reliable data that the government need for informed decision.
We are going to continue to put it in the budget of the state because of the importance that it has played significantly in changing the collection of data and management in Kaduna State. So all the subsequent budget for the year will continue to have it, so that it will be sustained in the state. More so, the personnel that are within the system, we are going to retain them, and we'll continue to train and retrain those that are within the system for sustainability.
But for one thing is the scaling up. We talked about scaling up. We have a good number of graduates, but we need to do better to meet our IT needs, our data needs based on our population size. So we need to have a better ratio per unit population. So more people, maybe each LGA we are hoping to aspire to have, maybe we have to set a target gradually. So we plan to scale up. That is one. Now, secondly, the issue of employment for them. We have integrated them into the health sector and our various MDEs, but they're here as temporary personnel. We hope to be able to convince His Excellency the Governor, and I know that the Honorable Commissioner for Planning and Budget is in the process of trying to convince him for us to establish a system where graduates of the Data Fellowship can have automatic employment, permanent employment, or at least a contract appointment that is 2 or 3 years into the state civil service, because we need them. I was at a meeting yesterday and other sectors, agriculture, etc., were talking about needing them to assist with data management. If we have a system where they graduate and they have the option of employment and a continued source of income permanently into the state civil service, we'll be able to integrate them. Now, once integrated, they will be able to mentor and step down the training to a larger number of people. That will fill part of the gap we're facing. Now, thirdly, of course, we are aiming for greater ownership. Presently, almost all the funding comes from the Bill and Melinda Gates Foundation and their implementation partners, because we do have fiscal challenges like the rest of the Federal Republic of Nigeria. Everybody knows that in the world. So we are hoping that gradually we as a state can have a greater stake in the running of that data lab in terms of funding responsibilities and greater ownership. Gradually, we want to one day eventually achieve a situation where Kaduna owns and runs its own data lab. That's the best way to achieve sustainability.
This has been the challenge that the Kaduna Data Lab Project faces today. A challenge it is more than prepared to meet. Long-term sustainability requires foresight, strategic planning, and strong commitment. For the Kaduna State Bureau of Statistics, KDBS, the goal is clear: to embed the culture of data-driven decision-making so deeply that it becomes an integral part of governance and public service delivery. The Kaduna Data Lab Project is a blueprint for what is possible when data is harnessed to drive development. As the Kaduna State government looks to the future, there is immense potential to scale this model to other parts of Nigeria and beyond. The Kaduna Data Lab Project has illuminated what is possible when we dare to dream, when we dare to invest in people, and when we dare to invest in the future. The faces you see here and the stories you have heard are more than just moments in time. They are living proof that when we empower people with knowledge and build their capacity to think critically, analyze, and innovate, we set in motion a chain reaction that can change the world. The future belongs to the informed. It belongs to those who understand that data is about people, lives, and what we can achieve together.